अस्सलाम वालेकुम। आज हम बात करेंगे डिक्लेरम्बोल्ट सिंड्रोम के बारे में। लेट्स स्टार्ट विद अ सैम्पल केस। A 38-year-old single woman is brought by her family to your clinic after repeatedly sending letters and emails to a well-known television anchor. She says that he is secretly in love with her. शी बिलीव्स कि एंकर जब टीवी पे या एयर पे वर्ड्स बोल रहा होता है तो द चॉइस ऑफ वर्ड्स आर फॉर हर, डायरेक्ट glances at the camera are for her, and he sends coded messages that are only for her to understand. When confronted with evidence कि maybe that's not true, she insists कि वो इसलिए openly नहीं कहता because उसकी public image damage हो जाएगी, लेकिन I know that that person is in love with her. She denies hallucinations, लेकिन she has poor insight into the condition, does not use substances, the mood is elevated but without pressured speech. So, this syndrome, the Clerambault syndrome, is also called erotomania. This is a rare delusional disorder. This is a love delusion, and it was first described by, I don't know how to pronounce this, Gaetan de Clerambault in 1921. The central theme is that the patient is thinking that the other person is in love with them secretly, and they cannot be convinced otherwise. Okay? So, this is a delusional disorder, erotomanic type. Core clinical features क्या है? They are having a delusion that the other person is is in love with them, and usually the other person is having a higher status. They are famous and they are inaccessible. ठीक है? Misinterpretation of neutral acts as signals of love. Epidemiology की बात करते हैं. Usually it is women who have this. Generally rare disorder है, लेकिन अगर होता है तो women में ज़्यादा होता है. इसका onset ये early to middle adulthood में. It can be primary or it can be secondary. ये आइसोलेटेड भी हो सकता है, यानी कि प्राइमरी डिसऑर्डर भी हो सकता है, या इट कैन बी सेकेंडरी और पार्ट ऑफ सम अदर कंडीशन लाइक स्किज़ोफ्रेनिया, बाइपोलर डिसऑर्डर और डिमेंशिया. Clinical presentation. This person might write letters or make calls or stalk that said person. Refusal to accept denial, he denies it because of society or pressure. ठीक है, कन्विंस नहीं होते. वो कहेंगे कि नहीं, उसकी कोई मजबूरी होगी या उस पर कोई प्रेशर होगा, इसलिए वो ओपनली एडमिट नहीं कर पा रहा, एंड सो ऑन. फिर आइडियाज ऑफ रेफरेंस, जो भी वो कुछ भी करता है टीवी के ऊपर उसको लगता है कि वो उसके लिए है, और ही हैज़ वेरी पुअर इंसाइट इनटू द सिचुएशन. Differential diagnosis. Okay, so if a patient like this comes to you, the first thing is you should always think about maybe it's just a obsessive kind of fan. It is normal infatuation, which is normal in इस age group की लड़कियां वैसे भी. तो it could just be that. नंबर टू ये कि delusional disorders कोई और भी हो सकते हैं like grandiose या persecutory. नंबर थ्री schizophrenia हो सकता है. नंबर फोर bipolar की manic phase भी हो सकती है. Risks and complications. This person might harass or stalk, intrusive behavior हो सकता है. Strained family and social relationships हो सकते हैं. Violent हो सकते हैं, अगर आप उनको बहुत ज़्यादा कहें कि नहीं तुम deluded हो, ये सच नहीं है, तो violence का एक risk होता है. फिर of course ऐसी हरकतें अगर होंगी तो फिर legal consequences भी होते हैं. तो these are all very important factors. मैनेजमेंट में आए तो फर्स्ट लाइन इज एंटीसाइकोटिक्स. अगर पेशेंट बाइपोलर है तो मूड स्टेबलाइजर्स might help. Supportive psychotherapy helps. Legal safety interventions might be needed if harassment risk is high. What is the final key takeaway from this presentation? So, erotomania is a fixed false belief of being loved. Target is often of a higher social standing, frequently resistant to contrary evidence, and management may pharmacological, safety, and psychoeducation. If you like this video and you want to see more of such videos, please like, comment, share, and subscribe to my channel, and follow me on Instagram and Facebook where I regularly upload content. If you like this video, please support the channel. I'll be back with more videos. Allah Hafiz.